Hello people, myself Dr.Shail Gupta. Today I will speak about the bleeding gums. What is bleeding gums and why it occurs, or what is the etiological factor, and what is the treatment modality. So everything I will discuss today about bleeding gums. So first of all, bleeding gums or gingival bleeding is the blood which comes out of the gingiva or the gums due to a disease named as pyorrhea. So why it happens? Suppose the oral hygiene is not clean, the mouth is properly not cleaned, or the second etiological factor may be like not having proper nutrition. In absence of proper nutrition also, gingiva bleeds because the gingiva also needs the adequate nutrition as a body needs. So it is a part of our body, the gingiva, so it also needs the nutrition. Third most important etiological factor why this bleeding gums happen. It is due to pregnancy. Most of the times due to pregnancy the women suffer the bleeding gums problem. So yeah, these all are the factors, and children also face the pediatric patients, the pedo patients also face the bleeding gums. And when we brush our teeth, so the blood comes out from our gums. So that is the situation when we see the blood coming out of our teeth or the the gingiva, the gums. And what are the treatment? What are the treatment? See, treatment is first of all scaling or the tooth cleaning we need when we have the bleeding gum. Second is that the gingival massage we need. Third is the irrigation we need, the irrigation of the gums or the gingival irrigation that dentist or the doctors do. And the mouth washes the doctors prescribe that you have to follow the in routine. The chlorhexidine mouthwash, it has the bactericidal effect, so it is the best mouthwash. I recommend chlorhexidine if you have bleeding gums. And bleeding gums also takes the form of pyorrhea. See, pyorrhea has 3 stages that I'll discuss about pyorrhea in some other video. So bleeding gums, if it is not treated in the pre-stage, it takes to different types of diseases like pyorrhea and all. So yeah, bleeding gums has to be treated. Second, it can take the form of halitosis, that is smelling of the mouth, the foul smell it comes from the mouth, that is known as halitosis. So about halitosis also someday I will make the video. So bleeding gums has to be treated. The toothpaste I recommend for bleeding gums is the Dabur Red toothpaste. Okay, not in the form of powder, it should be in the form of paste. So after doing the brush with the Dabur Lal toothpaste, just rinsing the mouth after brushing with that toothpaste Dabur Lal, and you have to do the you have to follow the mouthwash of chlorhexidine at least for 15 to 1 month duration. So your bleeding gums will go. And as I said, the scaling, the ultrasonic scaling has to be done. The irrigation of the gingival tissue has to be gingiva has to be done, and of course the medication may also be prescribed to you according to your situation, according to the doctors, and it will be treated. So and last I want to say, you have to thoroughly clean your mouth. You have to keep your oral hygiene very neat and clean. 3 times brushing you have to do with the toothpaste prescribed to you according to your condition and situation of the oral cavity. And please go and visit to the dentist if you are having bleeding gums or any tooth related problems. Okay, thank you.